Hi Bartonella buddies! Today I want to go over stories of people who had sometimes utterly disabling symptoms of Bartonellosis who went on to break down Bartonella. Buck Bartonella, Buck Bartonella, Buck Bartonella, Buck Bartonella. That way, anytime you feel low on hope, you can come back and rewatch this video as many times as you want to see that it's possible to break down Bartonella. For more Bartonella success stories, visit the video description box below this video, and I'll have links to my other videos with success stories. So one of them includes a video in which I go over case reports from the literature of people who have broken down Bartonella. Another one is my interview with Amy and Jack, so that hopefully will help you too. And then my third one, I go over a success story about a boy who had symptoms from Bartonellosis that were most similar to schizophrenia, who went on to completely regain his health, and that is in my neuropsychiatric symptoms of Bartonellosis video. But before we get started, I would just like you to take note of the beautiful earring design I have come up with that are up on my Etsy store now, and by the time that this video goes up, I'll probably have the silver version as well, and it comes in multiple color variations. So the first case report is about a 28-year-old veterinarian who got a spider bite while she was jogging in a wooded area near Raleigh, North Carolina. As an aside, I just want to point out that we can't prove from this study alone that spiders can transmit Bartonellosis, but it's definitely a topic that is worthy of more research. The next week, she developed fever and malaise, and the spider bite became very itchy, and it was painful for weeks. The week after her fever, she developed joint pain, leg pain, and pitting edema around her ankles. And pitting edema refers to edema, so that is tissue swelling usually due to trapped fluid, and the pitting part refers to when you press on the skin and it becomes indented and takes a while to fill back out again, kind of like memory foam. She also had tenderness when her legs were examined by a doctor. Her routine laboratory tests, including a CRP, sed rate, ANA titers, a complete blood count, and urinalysis, were all normal. A week later, the pain persisted, but the pitting edema had resolved. The veterinarian flew home to Spain, where she was examined by a rheumatologist who suspected that she might have sarcoidosis, which is an inflammatory disease that is marked by granulomas, or clumps of inflammatory cells that can aggregate in the liver, spleen, lungs, brain, and other organs, and is accompanied by symptoms such as fatigue, joint pain, shortness of breath. But once she had x-rays done, this diagnosis was considered unlikely. She tried ibuprofen, Tylenol, and prednisone, but none of them relieved her pain. Her pain continued to increase over the next couple of weeks. The veterinarian then flew back to the United States, and she had redness of the feet and cyanosis, which means bluishness of the feet, and she had intermittent severe attacks of pain. She experienced this pain when she was walking, standing, or even at rest, and it increased with warm water or with exercise. Her pain progressed to the point where she needed crutches or a wheelchair for mobility. A second rheumatologist thought she might have nerve injury in both feet, especially because her inflammatory markers like ANA and CRP were normal. Her left foot was colder than her right foot, and she had decreased sensation as evidenced by testing, pinprick testing, and vibration sense testing. Her electromyography or EMG testing and her nerve conduction study tests were both normal. She was diagnosed with complex regional pain syndrome, which is a syndrome in which pain develops in a limb, usually after an injury. And syndromes, as opposed to diseases, are a collection of symptoms that don't have a known distinct cause. The veterinarian was given tramadol and high-dose gabapentin for pain, and that decreased her pain to the point where she could work again. She requested to be part of one of Dr. Breitschwerdt's studies at the North Carolina State University College of Veterinary Medicine. She had 3 serum samples collected over a 5-day period in December 2009, and she tested positive for antibodies to Bartonella vinsonii subspecies Burkhoffii and Bartonella koehlerae, and she had titers that ranged anywhere from 1 to 64 to 1 to 1024. Bartonella koehlerae was amplified from her blood, from her serum, and it was amplified from an enrichment culture that both NC State and Galaxy use to help the Bartonella grow exponentially, since it's a slow-growing organism. 2 months later, she was still seroreactive, and they again amplified Bartonella cholerae from the enrichment culture. 4 months after the onset of symptoms, her pain again became intolerable despite being on the tramadol and high-dose gabapentin. So she was prescribed nortriptyline, which is a type of antidepressant that can help with nerve pain, and that helped her reduce the pain to the point where she could walk short distances without crutches. So because she had the positive testing for Bartonella cholerae, she started treatment with 100 milligrams of doxycycline twice a day and 300 milligrams of rifampin twice a day. But the doxycycline gave her severe esophagitis, so that was switched out for azithromycin, and that was taken 250 milligrams once a day. She was on this combination of antibiotics for 3 months. At the end of therapy, she was able to walk without crutches, she no longer needed the wheelchair, and she could come off all of her pain management meds. They tested her blood again 3 months after the end of therapy, and she was still seroreactive, but she was PCR negative. 3 years after the initial fever episode, the veterinarian remained healthy except for mild burning in her feet that was exacerbated after prolonged exercise and hot and humid weather. So I would say that despite that one remaining symptom, this is still a success story. I mean, she was able to exercise for prolonged periods of time. I think she had a few things going in her favor that allowed the treatment to be as short as it was. One, I think she was diagnosed and treated relatively quickly after the onset of symptoms, and she obviously was very responsive to antibiotic therapy. I'm getting sweaty actually from being hungry. Okay.
Oh, this I forgot to turn off. Everybody knows you're sweaty now.
I'm sweating up here. Oh my god, this feels so good. Now I just need a hot cabana boy to do it for me while I'm talking to you guys. Where is he? So I also think it's important to remember that this woman was treated over 10 years ago, and so the treatment that she received may not be as comprehensive as the treatment one might get under a BLMD today. So with all that I've been through, if I get the outcome that she had, I would be ecstatic. So our next success story actually comes from a survey I did through Google Forms, and I asked people who had healed from Bartonellosis to fill out this survey. So don't worry, they gave me their consent to use their medical information in this video, and I'm not just putting it out there on the internet. I wouldn't do that. Our next woman is about a woman in her early...
Our next woman is about a woman.
So this story is about a woman in her early 30s. She tested positive for Bartonella via Galaxy Diagnostics, and this woman assumes she was infected around age 7, and the symptoms started off as mild, but they became more severe in early adulthood. Her main symptoms included insomnia, severe anxiety, severe GERD, muscle and joint pain, strep throat, and chronic sinus infections. She was treated by Dr. M and did the antibiotic protocol of koehlerae and rifampin, followed by switching out the rifampin for rifabutin. But as we know, treating Bartonellosis is not just about the antibiotics, it's about addressing the immune dysfunction and the comorbidities. So her treatment protocol also included treating small vessel disease, candida, SIBO, hypothyroid, adrenal fatigue, and managing mast cell activation syndrome all at the same time. And I asked her how she treated small vessel disease, and she said treating the Bartonella and the overall inflammation, but she also took B vitamins and a supplement called Vessel Guard. And for the part where she was asked to write her advice to someone who's going through Bartonellosis, she wrote, quote, "No matter what, keep fighting. It is possible to fully recover and get your life back." I wholeheartedly agree. And this last story I consider a success story because she had severe symptoms, and after treating the Bartonellosis and addressing the immune dysfunction, she was able to return to work. The case report doesn't completely finish out her case because that wasn't the point of the case report. The point of the case report was to show an association between immunological dysfunction and Bartonella. But I feel like this is a success story because, as I said, she was able to return to work. So this case report is about a 49-year-old veterinarian who managed a cat shelter with 500 cats. 525,600 kittens, 525,000 opportunities to get infected, 525,600 kittens. How do you measure the risk of Bartonella? The risk is high. The risk is fucking high. In 2011, she handled a cat that was infested with mange mites. Yikes. A month after that, she experienced an episode of confusion with severe headache. Later that evening, she had another episode of confusion and headache, and she experienced a 15-minute episode of aphasia. And aphasia is the medical term for the loss of ability to understand and express speech, and her husband was there to witness that episode. After 3 hours, all the symptoms had resolved. She would experience an aura before her symptoms came on, and an aura is a sensation that patients often feel before they experience something like a migraine or a seizure, and it can include flashing lights or ringing in the ears or difficulty speaking. Whenever she would experience an aura, she would stop whatever she was doing, whether that be performing surgery or driving, which is kind of sketch. The episodes began by occurring once or twice a month, but over the next 4 years, they increased in severity and in frequency to the point where she was having them 20 to 25 days a month, and they would last anywhere from minutes to hours. She then began having seizures and problems with her balance, so she started to have problems with walking and experienced falls. Her extensive neurological testing was normal except for an EEG, which is a test in which they place electrodes over your scalp to measure brain waves. The test showed left temporal brain slowing, which may indicate brain dysfunction. Lobe slowing. It kind of sounds like a winter sport.
Yes.
I'm a professional lobe slower. Tits deep in pow. She started an anticonvulsant medication called levetiracetam, and that helped her with mental clarity. But soon after, her symptoms recurred and her condition deteriorated to the point where she could no longer work. She had an MRI and a SPECT scan, and both of those showed abnormalities, and I won't go in depth here, but I'll put the citation in the video description box if you want to read the case report yourself. She also had abnormal immunological testing, and I won't go in depth on that either, but one of them showed that her natural killer cells were profoundly low. She was tested for Bartonella using the enrichment medium that both Galaxy and NC State use, and she was positive for Bartonella henselae via her blood culture. She was negative via IFA testing. She began treatment with clarithromycin and rifampin, and she began IVIG, and she received IVIG every 3 weeks. And 6 weeks into this protocol, her headache started to lift and she returned back to work. After 9 months on being antibiotics, her IFA test was positive, so that means she started to create antibodies to Bartonella henselae and Bartonella quintana. And she was PCR negative. In the 9-month follow-up, she no longer had seizures, but the MRI that she had previously, she then had another MRI, and there was no difference between those two MRIs, even though they were a little over a year apart. Her white blood cell counts returned to normal, but her natural killer cell function still remained low. And unfortunately, that's where the case report ends. But I would say going from 20 to 25 days per month of having episodes and or seizures to being able to go back to work is a success story. If you have a Bartonella success story to share, please consider filling out my survey. I'll put a link to that in the video description box below the video. If you're new to my channel, my name is Jake. Give this video a thumbs up, share it wherever you can, and don't forget to hit that subscribe button if you haven't already. I really want to make helping people navigate their chronic health journeys my job, and there are a few ways you can help me do that. You can find my Etsy link in the video description box down below, and there'll be a link to my Bartonella Babe apparel as well. 25% of the proceeds go to Bartonella research, Dr. Breitschwerdt at the North Carolina State University College of Veterinary Medicine. And if you appreciate my hard work and advocacy, and if you are in a position to do so, you can consider donating to my channel via PayPal or Venmo, and you can find the info for that in the video description box as well. Piper, what's your favorite song from Rent? I like the one that goes like, "Will you light my candle?" Piper, you're a good singer. Be brave, Bartonella buddies. Bye! Da 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 da.